Hey, it's your friendly vegetarian here, Vanessa Marquez, and you are listening to Bariatric Surgery, the Good, the Bad, and the Ugly on the Skinny podcast. This is a multi-part series that I created because I actually wanted to be able to give you some insight into what it's like after surgery. And there's no better way to do that than to be able to talk to people who have actually had the surgery and can share their experiences. Last week I interviewed Mallory Berardo Marquez. She had the lap band. And this week we are sitting down with Ms. Nadine Singh, who is a nurse practitioner and the CEO and founder of Premier Mobile Health Clinic in Fort Myers, Florida. She and I discussed the differences and some of the similarities that got us to the point where we both decided, okay, we definitely want to have the surgery to reboot our health and help us with weight loss and finding courage and finding motivation to just, really get healthy and fit and everything that comes with that, the confidence. So let's have a listen. I hope you enjoy it, and I will see you soon. I am here today with Miss Nadine Singh. She is a nurse practitioner and she is also the owner of Premier Mobile Health Clinic in Fort Myers, Florida. How's it going, Miss Nadine?
Awesome.
Awesome. I wanted to do a series on bariatric surgery. I think it's a surgery that a lot of people kind of reach a point in their life that they are like, okay, maybe should I consider it? Should I not? So I wanted to cover the good, the bad, the ugly of the surgery. I personally have had gastric bypass, and Miss Dini here has had the gastric sleeve. So we just wanted to have a conversation pretty much of what got us to this point. So my first question for you, Miss Dini, is at what point did you realize that you needed to do something, that you needed to make a change for your health, to improve your health? What made you decide that bariatric surgery was good for you?
Well, I had 3 children, and after the third, my last child, LJ, who is now 6 years old, I was diagnosed with hypertension, pregnancy-induced hypertension. I was placed on medication, and post the medication, post the pregnancy and the diagnosis, I went into the gym. I began eating right. I was dieting. I was exercising. I had done all the right thing. I was doing everything that I possibly could do. I lost the weight, but I couldn't shed the medication. I still needed the medication. Then I had gestation diabetes, and next thing you know, they say the study shows that once you have gestation diabetes, you are prone to becoming diabetic anywhere from 10 to 15 years post being diagnosed with gestation diabetes. Well, 2 years later, I was indeed diabetic and was placed on metformin. And of course, with the hypertension, the diabetes, and of course, the morbid obesity, I was still gaining weight despite the diet, the exercise. I went and saw my general practitioner. She recommended that I saw the bariatric surgeon, and he said I was the ideal candidate. I was doing everything right, and we went. I did the program. I was seeing a nutritionist. They were managing my diet. We were doing everything, and still my BMI didn't move. My blood pressure didn't waver. I still needed medication, and I was indeed a candidate for the gastric sleeve. Post the gastric sleeve, I today currently still take blood pressure medication. However, I'm no longer a diabetic. That was indeed change. I lost 80 pounds post gastric sleeve, so that I am happy. And I maintained the weight loss. This has been since 2015. I'm 4 years out. Wow. And I continue to maintain the weight loss.
That's amazing. And that's one of the things that I wanted to touch on because, excuse me, that's one of the questions that I get, well, it's not a fix-all. It's a tool. It's a tool that's available for people who need it. I'm glad that you brought that up, because maintaining the weight loss is definitely something that's it's easier to do. It's easier to do with post surgery, right?
Mm-hmm.
But it's still something that you have to maintain. It's still something that you have to work at. I'm so happy that you're no longer a diabetic. I was able to reverse mine when I became a vegetarian, and I lost like 34 pounds. My issue came in because I couldn't keep the weight down. This was before surgery. So I started having a ton of issues, as female issues. My A1C level started to go back up. At one point when I was diagnosed, it was 11.5, and with diet and exercise and losing the weight, I was able to get it to 6.5. But keeping that was a difficult part. I lost 34 pounds before surgery, and then I gained 40. And then my doctor was like, Vanessa, if you don't do something, you're going to have to go back on meds. You're going to, have diabetes again. And that's when I was like, okay, I've reached the end of my rope as far as what I could do. And I decided to have gastric bypass. Now, I know there are 3 different types of bariatric surgeries. There's the bypass, the sleeve, and the band. What made you decide that the gastric sleeve was the best surgery for you out of the 3?
Well, being a medical personnel and taking care of a lot of people who have had gastric bypass, I've seen a lot of complication with the Roux-en-Y. I've taken care of multiple, not saying that every of the procedure has its own devil. Mm-hmm. I've taken care of many people with all sorts of complications, but the Roux-en-Y, I've seen the most complication.
The Roux-en-Y being the gastric bypass.
The gastric bypass
has
been. I've seen so many complications. I've seen a lot of people with hair loss, anemia, vitamin B deficiency. I've had tons of disorder, the dumping syndrome, a lot of complications from the gastric bypass. And so the sleeve have its ugliness to it, because in the beginning stages you can't eat anything. Like both of them, you can't eat in the beginning stages.
Yeah.
But at least with the sleeve, with the healing process, you begin to able to tolerate a little bit more. The hair loss is not as significant as in the bypass, and the trauma, to me, that's in my opinion, that you could do your own research and your own study, mm-hmm. is not as significant as in the bypass.
Yeah, there's definitely, I experienced the hair loss. I want to say probably, I started about 4 months after surgery. I was also, my father passed away 4 months after surgery as well from cancer. I was taking care of him. I decided to have surgery as I was taking care of an ill parent. I don't recommend that for anybody, but it was one of those moments in my life where I was like, if I don't do it now, it's never going to happen, All
right.
But it was definitely a difficult decision to make, because you kind of have to, figure out like what do I need to take care of myself while you're taking care of somebody else. I experienced a hair loss like crazy, and that really scared me. My hair was super long. It was like halfway down my back. I couldn't put it up because it looked like a little rat's tail, Mm-hmm. So. And there are definitely some commitments that you're making with any of these 3 surgeries. The vitamin deficiency, the anemia, I've experienced those, and mm-hmm. we're here to be really honest with, mm-hmm. with whoever's watching or listening. So if you want to know what it's like post-surgery, these are 2 examples. Mm-hmm. I definitely experienced the hair loss, became severely anemic. I want to say probably about 2.5 years after surgery. I had iron transfusions, and those are they're difficult, and you have to have them done once or twice a week, and I did that for several weeks. There are definitely pluses and minuses. It's not all glorious, and that's what I wanted to have a conversation about today, mm-hmm. because there is a risk, and while there's always a risk with surgery, there are some pluses after that. I no longer had diabetes before surgery, but I no longer have diabetes, period. I have been able to keep the weight loss down. I lost a total of 117 pounds. Like Deanie said earlier, she lost 80, right? Around 80. What was your starting weight, if you don't mind me asking?
I was 230 plus pounds.
Yeah, so was I. My highest was actually 237, and when I went into surgery, because they made me lose about 20 pounds before surgery. When I went to the doctor for bariatric surgery, I had plateaued at like 223, which was always like my plateau. I always was stuck between 213 and 223. And then they made me lose weight. So they were like, we want you to lose at least 20 pounds before surgery. And I lost, I think I was 209 when I went in for surgery. So it was definitely a process. Like I said, these surgeries are almost like a restart button. They give you the ability to restart your journey back to health. What would you say is like, do you still enjoy food to this day? Because I know that's a question that I get a lot.
Now I am. Before, I had no appetite, nothing tastes good. I had no desire for anything. I'd bite and throw away. I still would take a bite of something just because it's there, but I didn't have a desire. Now, 4 years later, the desire does come back, and I have a taste for something. I do have the return of the guilty pleasure, which I don't like.
Right.
Because those are the things that get us into trouble in the first place. Yeah, 4 years later, my guilty pleasures are coming back, which I have to remind myself, stay away from the guilty pleasures, because the guilty pleasures are the issues that I had that put me into the situations that caused me to have gastric sleeve.
Gotcha. Understandable. My weakness are Doritos and chips, which is weird because like
Mine's with cheese puff and soda.
yeah. Yeah, I could really care less, and maybe it's the dumping syndrome, which, dumping is when you have gastric bypass, your body cannot digest sugar like I did before surgery, so you're either going to eliminate it one way or the other. That's what they call dumping for patients who have had gastric bypass, but I enjoy saltier foods now than I did before surgery. Some people enjoy sweeter foods, which if you have dumping, it's not a good thing. But you can enjoy foods in moderation, and I think that's the thing that you want to walk away from with this, is that you want to do it within moderation.
Right. I get a bite, I satisfy my taste bud. Yep. And I don't devour the entire thing. I just get a bite, I satisfy my taste bud, and I throw the rest of it out. I don't eat the entire thing.
Right, and I do that too. Like, I'll grab a couple of chips, put the bag away. I don't sit in front of the TV with the bag of chips, What would you say? We are both super busy individuals with our life, with our career. You have children. I travel to come see her 2.5 hours so that we can do this interview. So what would you recommend for someone who has a really busy life, who is considering this surgery? What can they expect?
Your first year is the worst. It's the most miserable year. You're going to feel mixed feelings. You're going to regret doing it. Don't regret doing it. Your results is amazing. You're going to look good. Exercise, drink. The funny thing is, I have a problem with drinking water.
So do I.
And because of that, I stay dry. My lips is always cracked. So I try to moisturize my lip a lot. But people think I'm weird because water literally makes me nauseated. And so I can't drink water, and people think I'm crazy, but that's their opinion and they can keep it to themselves. However, you have to stay hydrated. I find other ways to make myself hydrated. But it's important for you to stay hydrated to avoid the pitfalls of the gastric sleeve, because it makes you dry, it makes your urine very cloudy, very dark, and you have minimal urine because you're not drinking as much as you should. You don't eat as much as you used to. So your body has to get used to the new you. So you have to take in a little bit more protein than you used to. First, you have to get your mental capacity up to where you need to be. So watch a lot of YouTube video to prepare yourself for the process. It's not an easy process, so you have to watch videos. Not everybody's story and everybody's journey is the same. Your story is going to be different from everybody's story. We're unique in our own right, so what Vanessa experienced may not be the same thing I experienced. When I had my surgery, I had a lot of, excuse my expression, a lot of spitting up. I couldn't keep anything down. The first year is the rapid weight loss and getting the used to your new body image. because the weight loss is rapid, and getting used to the new you, because you've used to yourself with the weight, the overweight. You've become accustomed to the way you were looking. So the the rapid weight loss, changing your structure, the physical appearance. I remember looking in my mirror and crying because I think I look so cachectic, meaning I look like emaciated. I felt like I was sick, like someone who had probably AIDS or cancer. And I was crying. I had to get used to the new me. And my brother hugged me and told me, "Yeah, you look beautiful." I had to remind myself it was still me, because I had to take, it takes a mental, it worked on my mental, because I had to get used to the new me.
Mm-hmm.
You know, I had to get adjusted to the new Deanie. um, 80 pounds less, lighter, you know. And
Right.
so it does take a toll on you, you know, just as how the overweight was working on you and working on him. Like, you get up every day and, oh my God, I'm so overweight, I'm so heavy, I'm so fat. You know, we don't like to use the word, but in reality,
Call it
you
what
know,
it is.
you call it what it is. If it's a milkshake, it's a milkshake. You know, if it's fat, it's fat. And I used to punish myself. My belly was, when I put my jeans on, my belly was tugged over, and I
Yep.
didn't like how I look. You know, I didn't consider myself as sexy. And one thing weight loss surgery does to you is give you your confidence back. It gives you a boost of your confidence. Now you walk out and you, and it, yes, and so plenty of people is gonna say, well, you shouldn't take weight loss to get your confidence back. Well, it did that for me. It boosted my confidence. It gave me a new zoom on life, and it made me feel great again. And for everybody, it's gonna be different. And so, and I empower those who can be the plus size woman, and don't do weight loss, and have the confidence and the sass, and own their pizzazz, and be who they are and confident in their skin, and power to them and being great. But for me, it did give me some confidence and boosts my level of confidence, and make me feel like I could conquer the world again. And so I'm grateful for it. And I'm hoping to keep the weight off, and keep encouraging people who wants to have bariatric surgery, especially those who have diabetes and hypertension and all the other ailment that is, it helps incontinence, it helps diabetes, and it does help other people who have hypertension on it. It unfortunately, it did not cure my hypertension, but there are many people who had hypertension that it has cured. For me, it didn't help my hypertension. I still take blood pressure medicine today, but it did cure my diabetes, and it did cured my overweight. By I dropped 80 pounds, and today I'm able to keep it off, and it's been 4 years.
Absolutely. And that's one of the things that it's super important that you take away from this. Everybody's experience is personal. So, your weight loss, the amount of weight loss, that's personal to you, to your body. Listening to us, these are our experiences, but yours is going to be different. Some people, like, I remember, like, waking up after surgery, and I remember till this day the very first thought that crossed my mind is, what the heck did I do to myself? And I was the one who was super excited, who was like, okay, great, I get to have surgery, I'm going to lose weight, I'm going to feel amazing. Guess what? All of those things are true. But the first thought that crossed my mind waking up from surgery was, what did I do to myself?
Mm-hmm.
And so the journey began. And, my doctor had me on a liquid diet before surgery, and then post-surgery for about 4 weeks. So, it was definitely an adjustment. But like I said, your experience is your own. This is Deanie's experience. I have shared, and definitely check out my podcast on, like, my own personal experience just with gastric bypass. Everybody doesn't have the same symptoms or the same side effects to food. I love food now. I enjoy different kinds of food right after surgery. My favorite food till this day is pizza. Yes, I can eat pizza. in very small quantities. But right after surgery, when I was able to start eating solids, it tasted like cardboard and I almost cried. Dini, I was like, oh my God, my favorite food is gone. I will never eat that again.
Yes.
That wasn't the case, but it's part of my process. And your body will let you know what it can and cannot tolerate. Be patient with yourself.
The ripe banana has never tasted the same. I'm still not able to enjoy a ripe banana. It doesn't taste the same still. But it's for another podcast.
All right. I hope you enjoyed that conversation with Miss Nadine Singh. I love how candid and real she is about her experiences. Tune in next week for a conversation with Pierre Venant, where he and I discuss gastric bypass. We both had the same surgery, but we'll be comparing and contrasting the differences, even just from a man's perspective and a woman's perspective. If you have any questions, please feel free to leave them below. Any comments as well. I will read them. I will respond to you. Don't forget to like and share this video with your family, friends, or anybody that you know that's considering bariatric surgery. I really do hope that this video series is a good resource for you so that you can see from a patient's perspective the good, the bad, and the ugly after surgery. It's not all glorious and magical weight loss. It is a process. It is a commitment on your end. But it's so worth it, guys. Thank you again so much for tuning in to the Skinny Podcast. I will see you next week.